We are going to discuss about sudden death. So we have heard sometimes without knowing any reason, suddenly a person is died like that. So what is that? What is sudden death? Why it is causing? What are the cause of sudden death? What are the characteristics of the sudden death? So the person who is not known to have suffering from any dangerous disease, injury or poisoning, why he dies? Why he dies? This reason is sudden death. So after the onset of the symptoms, so what are the characteristics? Suddenness of the death, unexpectedness of the death, sudden cardiac death, which is unexpected death due to cardiac causes which occurs in a short time period, which is generally within 1 hour of the symptom onset in a person with the known or unknown cardiac disease. So if we do autopsy in sudden death cases, what will happen? We should first notify external examination of body and meticulous clear internal examination of all systems should be all like systems should be examined. Each organ should be weighed and cross examination findings are noted. If a disease in an organ is suspected, the entire organ is preserved in 10% formalin for histopathological examination. Viscera should be preserved for chemical analysis. What are the diseases of cardiovascular system which cause sudden death? Major cause of sudden death in adults are coronary artery disease, hypertrophic obstructive cardiomyopathy, dilated cardiomyopathy, myocardial infarction, rupture of the myocardial infarction, valvular heart disease, arrhythmias, rupture of aortic aneurysm, myocarditis. So, how do you remember all this? Means myocardial infarction, which we commonly call as heart attack, like that. So, you can remember it. And cardiac arrest cases, coronary artery disease, main arteries in the heart are coronary arteries. So, any disease to them causes sudden death. And if there is any obstruction which is causing uh, hypertrophy and increased muscle mass, which is known as hypertrophic obstructive cardiomyopathy and dilated cardiomyopathy. So rupture of the myocardial infarction. Myocardial infarction we had already discussed. So its rupture causes its rupture also causing the disease, sudden death, valvular heart disease, and arrhythmias, any change in the rhythm like ventricular fibrillation, ventricular tachycardia, long QT syndrome, rupture of the aortic aneurysm, and myocarditis. So inflammation, general inflammation, myocarditis. Strongest known predictor of the sudden cardiac death is significant left ventricular dysfunction of any cause. So what are the disorders of the respiratory system? Respiratory system disorders are main cause of sudden death in case of infants and children, like pulmonary embolism, bronchial asthma, TB, bronchitis and bronchopneumonia, air embolism and pneumothorax. Air embolism, here also we are discussing air embolism, okay. As we had already studied about air embolism in the previous lecture or previous video, here also air embolism is a cause of sudden death in the infants and children, okay. And what are the diseases of CNS? The rupture of berry aneurysm. Aneurysm means abnormal dilatation of the blood vessel. It appears as a sac. So the aneurysm ruptures cause hemorrhage, which further leads to death. So intracerebral hemorrhages, stroke, ischemic or hemorrhagic stroke, and pontine hemorrhages. These are the diseases of CNS which cause sudden death. So stroke, pontine hemorrhage, intracerebral hemorrhage, and berry aneurysms. What are the diseases of gastrointestinal tract that cause sudden death? Is acute pancreatitis, variceal hemorrhage, gastric or duodenal perforation, strangulated hernia, intussusception of the bowel. So, what are the causes of the genitourinary tract that causing the sudden death? Rupture of the ectopic pregnancy. As my first OT which I went is this only ectopic pregnancy rupture. So I don't know some rupture case. Intern ma'am said some rupture case they are discussing like that. So I went into OT and asked the PG ma'am, what is the rupture case? Is there any rupture case like that? And I asked ma'am whether it is uterine rupture. I asked ma'am said if there is uterine rupture, uh, there is no chance of means very little chance of life. It is not that it is ectopic pregnancy means fallopian tube the like the product of conception is there, and it didn't reach the uterus, so fundus of posterior part of fundus of the uterus, and it is there, and due to it will gradually grows, no, it will gradually growing, and it causing rupture. So it get ruptured due to the narrow space of the tube, and it is causing the bleeding there, and due to the bleeding our body will produce some clotting factors to control the bleeding, and again clot is forming. So this is leading to the very serious conditions like sepsis and uh, DIC is occurring. So it may leads to death of the pregnant woman. So it is an emergency, and it may cause sudden death. Okay, toxemias of pregnancy, as you know, eclampsia, preeclampsia, gestational hypertension, these are toxemias, and amniotic fluid embolism, internal hemorrhage due to the fibroids. So miscellaneous causes of sudden death are anaphylaxis, pheochromocytoma, Addison's disease, shock, and thyrotoxicosis. Shock is also a cause. Anaphylaxis, pheochromocytoma, Addison's disease, thyrotoxicosis. This is guys for today. This is about sudden death. What are the causes of sudden death in CVS, respiratory system, CNS, and genitourinary tract, and GIT, and miscellaneous cause. Hope you get the point. In respiration system, we saw pulmonary embolism, pneumothorax, TB, bronchitis, pneumothorax, air embolism. GIT, acute pancreatitis, variceal hemorrhage, gastric or duodenal perforation, strangulated hernia, intussusception of bowel. GUT, there is rupture of ectopic pregnancy, toxemia of pregnancy, amniotic fluid embolism, uterine hemorrhage due to fibroids. Miscellaneous causes: anaphylaxis, pheochromocytoma, Addison's disease, shock, thyrotoxicosis. Okay, guys, this is for today. Thank you. This is sudden death.